Bismillahirrahmanirrahim. Assalamu alaikum. A 19-year-old college student is brought to the emergency department by his friend due to severe retrosternal and upper abdominal pain. The patient was out with his friend drinking alcohol and celebrating the end of final exam week. An hour before arrival, he had several episodes of emesis, which is when he began experiencing the pain. He has no medical issues other than ankle sprain while playing basketball. The patient has smoked cigarette on several occasions and drank alcohol on the weekend. His father died of myocardial infarction at age 45. Temperature 38, blood pressure 95/56, pulse is 120 and respiration is 30. Pulse oximetry is 97% on room air. Height is 201 centimeter, weight is 90 kg. On physical examination, the patient appears intoxicated and diaphoretic. Oral mucous membrane are dry and there is no pharyngeal erythema. Cervical lymph nodes are not enlarged and there is palpable crepitus on the suprasternal notch. Lung auscultation revealed bilateral symmetric breath sound. Heart sound are normal. There is mild epigastric tenderness without guarding or rebound. There is no extremity edema or cyanosis. Which of the following is the most likely cause of this patient's current condition? This patient is 19-year-old college student. He is brought to the emergency department due to severe retrosternal and upper abdominal pain. An hour before arrival, he had several episodes of emesis when he began experiencing the pain. His temperature is 101 Fahrenheit, blood pressure is 95/56 mm of Hg, and pulse rate is 120 per minute. Respiratory rate are 30 per minute. The patient appears intoxicated and diaphoretic. There is palpable crepitus in the suprasternal notch. There is mild epigastric tenderness without guarding or rebound. Based on these here, the diagnosis of this question is esophageal rupture, which is also called Boerhaave syndrome. Boerhaave syndrome. So here, the correct option is choice D, esophageal rupture. This patient with retrosternal pain, fever, and crepitus in the setting of protracted vomiting likely has a full thickness rupture of the esophagus, which is called esophageal perforation or Boerhaave syndrome. Increased intraesophageal pressure causes full thickness effort rupture of the esophagus, which allow esophageal fluid and air into the mediastinum, which causes chest abdominal pain and systemic inflammatory response, for example fever, hypotension, which can lead to septic shock and death. Esophagography or CT scan with water-soluble contrast confirm the diagnosis. IV broad-spectrum antibiotic and proton pump inhibitor should be administered and oral intake restricted with emergent surgical consultation are obtained. Come to the photo of the Boerhaave syndrome. So this is the photo of the Mealy-Weiss syndrome and the Boerhaave syndrome. And the Mealy-Weiss syndrome, which causes in which the tear involving the mucosa and submucosa, there is not transmural tear in the Mealy-Weiss syndrome, while in the Boerhaave syndrome there is a tear which involving the mucosa, submucosa, and the adventitia, which involve the transmural rupture of the esophagus. Come to the incorrect one. Choice A, alcohol-induced pancreatitis. So alcohol-induced pancreatitis, which does not cause suprasternal crepitus and except in severe cases which cause multi-organ failure, is not typically associated with fever. Choice B. So a patient having aortic dissection, the patient first will having the risk factor, for example, hypertension, Marfan syndrome, connective tissue disorder, and patient will have severe chest pain which is acute in onset, especially if the risk factors are present. Choice C, aspiration pneumonitis. So patient having aspiration pneumonitis, there will be typically present an abrupt onset respiratory distress with diffuse lung field crackles. Choice E, Mealy-Weiss syndrome. So as already I mentioned here in the photo, that patient having Mealy-Weiss syndrome, there is a partial tear of the esophagus, which involve the mucus and submucosal layer of the esophagus. Choice F, rupture of the suprapular bleb. So patient having rupture of the suprapular bleb will suffer from primary spontaneous pneumothorax, which can occur in tall, thin young men from rupture of the suprapular bleb. Decreased breath sound will be expected on the affected side, and fever is uncommon. Thank you.